And one of the things that sort of saddens me is that in the previous part of my life that I wasn't able to ever advocate, and I would hope maybe at some point in time the policymakers of the state could advocate the requirement of eye screenings for children now that we have a pre-K program, because you prevent children from being, getting the Scarlet Pimpernel, being labeled dumb, and then they're cast-offs, and they end up in many cases in the hands of mental health professionals because they don't know until the mental health professional picks up and says, well, here it is, or they have a visual screening. It would seem to me that just as we had the advocacy for so many years to do audiology testing upon birth, because you can't do optometric or ophthalmologic testing at birth, you have to wait until there's some transitional or translational system issue relative to brain function and eye function and things of that nature. And I don't mean to get so verbose here, folks, but we need to be able to do something about it. Anyway, that's my homily for the day.
I do hear your passionate desire to bring an improvement in the healthcare of vision, specifically for children. And I'm thinking of the dialogue that just happened and how you started the conversation asking a question about how, rather than merely, I think what you meant by PDR is physician desk reference, merely prescribing something from a 3,000-page book that gives you some ideas about what might be worth trying in modifying behavior for a child specifically that you think might have ADHD. The good news that you wouldn't know is that the Florida chapter of the American Academy of Pediatrics received a grant from the American Academy to look at how can we help the pediatricians in our state who are frankly working very hard, long hours, can't, even if they wish to, find 20 minutes, half hour, like you could maybe a few years back, to really sit with families and understand all the dynamics that Dr. Reitman's talking about. Who are the leaders in your family? Is it a grandma? Is it an aunt? Is it a mom? Is it a dad? What kind of living environment are you in? What kind of neighborhood do you live in? What is your school? Does the school have exercise programs? Do they not? Have you had a chance to get screened for hearing and vision, etc.? And if you do in fact have what could be considered a diagnosis of ADHD, where do I send you? Who are the behavioralists? So I'm happy to share with you that actually Dr. Reitman's program is looked upon as one of the best comprehensive coordinated that we have in the state, and has been a part of an advisory group that consults when they need further information to make sure that the programming that's being provided pediatricians statewide at no cost through what we call an EQUIP program. It's online. They're being better educated on what to look for, what to screen for, how to access community resources, and our hope will be that at the end of that grant, which is coming up, we'll have something to share with our colleagues that will better the lives of children and get them in the hands of those persons they need, whether it's an eye screening or behavioral health program.
Yeah. I'm editing a text right now with experts from all over the country working in various areas, not just ADHD, but also with kids that have major depression, anxiety problems. And one of the key issues today in the research community is how do we promote better assessment practice within the practice community? Because we have, just as you have in medicine, divide between those that are doing research, those that are working in research hospitals with all of those kinds of resources, and the average practitioner in the field who has few, if any, resources to support that kind of practice. So I think what we need to have happen is in the research community, look more carefully at the realities of clinical practice and try to develop procedures, assessment-wise and treatment-wise, that will actually work in the community. So I know that's an issue in medicine. It's clearly an issue in psychology, and we're not there yet, but I think the issue is on the table, and I expect a lot of progress to be made there.
Let me just, believe it or not, we're down to the last 4 minutes of the show.
Wow.
Yeah, but let me ask you this. With your activities at the Boys and Girls Club,
Sure.
do I assume that there's similar, it's a similar type of consultation, review, and things of that nature?
We actually do two things,
Right.
Dr. Littman. One thing that we do through our clinic is we provide consultation to the clubs
Right.
concerning children they may be concerned about, because the Boys and Girls Club, as many resources as they have,
Right.
don't have the resources to perform screening. So essentially what we do is I have graduate students that work in my clinic that are assigned to each club that the club directors can rely on for an on-site consultation.
Let me ask you just maybe editorially, has it been a success?
I feel very good about what we've done. I feel we can do a lot more, but my philosophy in working with organizations like the Boys and Girls Club, I used to work with Head Start in Louisiana prior to coming here. My philosophy is you need to develop a relationship with the community. That one mistake that universities have made in the past is to do one-shot research projects where you're there for a year and then you're gone. That doesn't really create the kind of collaboration that I want. So we're in the second year really of this sort of collaboration, and we're building on it. And every year I sit down with the club directors, David Hughes, Sam Jordan, and some of the other good people at the Boys and Girls Club, and we talk about what we've accomplished in that year and how to make it better.
Well, maybe the next step will be
Maybe
to take the NFL, who has adopted Boys and Girls Club as their
The Lester White.
Right,
Yeah.
and it would be really good to see. Maybe we can create a national opportunity.
Yeah.
Let me touch real quickly down to the last 2 minutes of the show.
Understand.
On the drowning issue. I know that we had successful legislation in the state of Florida.
Yes.
And now that person who was the shepherd, the policymaker who carried it through, Debbie Wasserman Schultz, is now in the Congress of the United
Yes.
States. And my understanding is she's filing a bill now.
It's filed.
It's filed, and
Yeah.
the Senate companion, I think, is.
I don't know the numbers, but she has a Senate
But
companion.
she has. I think it's. If I'm not mistaken, I can't remember which senator it is who had a child.
Baker is,
Oh,
it's
yeah.
named after Baker's
That's right.
grandchild who
It
died.
was right, Secretary Jim Baker's
Yes.
grandchild,
Yes.
and I'm trying to remember who the senator was. But whatever it is, it's important
It
because
is very important.
it's a national. It's a national advocacy to prevent drowning by creating certain parameters in relative to the protection of the pool environment, so the children can't get into those pools.
And I'm going to
correct?
have to ask Congresswoman's forgiveness for failing to remember the senator's name. It's on the tip of my mind. He's exceedingly well known.
We're down to the last
Yeah.
40 seconds of the
Yeah.
show, Deborah. So let me just ask you real quickly, if you had a wish other than good health for a child,
Yes.
what is your wish for children in this community?
Well, as I think all of us would, just to find themselves in a loving environment where they feel good about who they are and enjoy life and all the adventures that it has to offer, and meet the challenges with the kind of skill set that we would hope they have being raised in those sorts of homes, so that even in those days that aren't as good as some, you still get through them and you're still loving life and having a great
And
day.
it's up to us as a community at large, folks, to try to provide a safe environment for children of all economic structures of this community who live throughout this community, no matter who they are, one way or the other. And there is no such thing as politics when it comes to children. So thank you very much, Dr. Deborah Mulligan, for being here. Thank you for your leadership of the Child Health Policy Institute. Dr. David Reitman, thank you for your continued verve in the area of dealing with the I would say the mental challenges that are involved with children. Keep up the good work. Let us know what we can do to help. Folks, thank you for showing up again today and allowing us to get into your homes. Remember, this is your show. I just felt it would be necessary for you to understand that there are challenges to our children in the community, and that these folks work very hard at trying to make it better for your grandkids, your children, your nieces, your nephews. If you have any questions, just dial us up. We're here every week, as you well know, on this same station. So if you need us, give us a call. This is Nova Southeastern University. This is Dateline Health. It's your show. And until next time, see you.